Hi, my name is Kimmer Collison-Riss, and I'm here to talk to you today about the different conditions that are found on the Autism Spectrum disorders list, as well as talk to you about ADD and ADHD. One of the reasons why I'm discussing this is that ADD and ADHD share some very similar features with Autism Spectrum disorders. The big clinical term is pervasive developmental disorders, and those include autism, Asperger's, sensory processing, and they're now beginning to include attention deficit disorder and attention deficit hyperactivity disorder. The reason is all of these share some very similar features. The causes of all of these conditions, which are rising through each decade, not just because of increased awareness and increased knowledge from a provider standpoint, but also in terms of our access to information via the internet. But we also believe it's related to increased assaults from the environment. In all of these things on the Autism Spectrum Disorders list, genetics has always been a piece of it. Unfortunately, the medical community has a tendency to emphasize that genetics is the main cause, but what we know to be true today is that environment is a larger cause and a bigger culprit. And there are many different kinds of things that can cause the symptoms of autism spectrum. And they really are a list that overlap with each other. On the one end of the list, there is autism, where you can have it, if you class it on a scale of 1 to 10, a very severe disabled person who's not able to assimilate into society quite well, may not be able to speak, may not be able to take care of themselves, might be in a childlike state. And yet you can also have an autistic child be very, very creative, learn language, learn to walk and care for themselves, learn to a certain degree participate in society, but might always need some kind of support, life support. And then we have people that are Asperger's that share some similar autistic traits. Maybe they can't carry on a conversation, maybe they don't relate to other people at all, don't understand their feelings, absolutely adherent to routines in both autism and Asperger's. Might actually, either one of them might actually have some savant skills. Sometimes math or science is a very strong trait. Oftentimes these people have a difficult time with transitions, have a difficult time relating to others, are highly reactive to if there's a disruption in their routine or they don't understand something. Very disturbed sleep largely is a part of the symptoms. And Asperger's can be rated maybe on a 1 to 10 scale. And then there's sensory processing disorder, which is where a person might be hyperreactive to their environment or hyporeactive to their environment, or interchange and alternate between the two, depending on the situation or what's occurring with their body. But with sensory processing disorder, sensory features are always a part of Asperger's and they're always a part of autism, or they can stand on their own. And then next to that, on the scale down here, is attention deficit, which may have a hyporeactivity or a hyperreactivity, share some similar traits on the autism spectrum, but be its own entity, may be related to things like infections that occur in childhood, febrile seizures, high temperatures, may be related to food reactivity or food sensitivity, or allergies to their environment, or the inability to clear heavy metals. And then there's attention deficit hyperactivity disorder, where there's not just an attention and focus issue, but there's a hyperactive component that shows up in more than two environments. Maybe the student is both hyperactive or having attention and focus issues both at home, and it's quite a task to get them to try to do things, or also at school or in like another public setting. Now, when I'm speaking about all of these things, These things and these features change in severity as a person acquires tools in their lifetime and grows into an adult. And there are many people today that are now, as adults, being diagnosed with attention deficit or with attention deficit hyperactivity disorder or with sensory processing disorder or with Asperger's that may be completely unaware of it. And all of these things are on a spectrum, and each one of them shares similar features and overlaps. Some can be very distinct, but most all of them have a hyperactive, can have a hyperactive component or a very kinetic component or a very reactive component, but all of them have sensory pieces to it. When we're looking at causes, we're looking at smoking as being an issue, high pollution areas being an issue, unable to offload heavy metals that go into the body, things like aluminum, things like methyl mercury, maybe be exposed to lead from like old paint or from sometimes pottery that we use for dishware can have lead on it, can be exposed to other kinds of sources. A lot of the exposure with people on the autism spectrum, they were exposed either in utero when they were developing and neurologically their system was assaulted because they were very vulnerable, or immediately following birth where they were young infant developing and they were exposed to some kind of an assault, or maybe they had a really, really high fever or an infection like staph or strep, or they developed febrile seizures where there was a chronic inflammation, possible brain injury, and these features occurred. What we know is there is a suspicion, and it has been dismissed because it was a person who faked, there was a physician who faked a study saying, you know, vaccines conclusively were the cause of autism. And so people went ahead and said, oh no, vaccines are not a part of it. But vaccines could be a part of some of the environmental assaults that have caused autism spectrum, because one, we have reports of a baby being born that was a completely normal child until they received a number of vaccines, and then they developed a high fever or infection, or they changed dramatically and became an irritable, cranky, crying baby who could never be consoled, who could never be held or hugged, or could rarely be held or hugged, was always quite reactive, and they changed. And the parent report is always a really good tool to use and should never be dismissed. We do know that there is a new discovery called about a gene deletion called the MTHFR gene, and in some of these people there's like 66 different variants to these deletions, and they can affect people in different ways. But one of the main things is that people are not able to offload heavy metals, and we also know that vaccines do carry, some vaccines do have aluminum in them, and they still have thimerosal, which is a methyl mercury, and the body cannot offload it. Some of them have other contaminants like formaldehyde. The theory is that these products are small amounts and they're supposed to be help be preservatives. But what we know is that the neurological system, especially in a developing child, is so fragile and so vulnerable that what would be considered a very small dose for an adult or larger bodied person is not considered a safe dose. And in fact, the EPA has no list of safe doses for aluminum or for methyl mercury or for formaldehyde ever. And so these should never, ever, ever be a part of a vaccine in the first place. Some children have had terrible infections where they became very, very sick. We don't know if it was a virus. Sometimes it's a bacterial infection. Sometimes it's a combo that causes chronic inflammation in the body, and that chronic inflammation can lead a normally happy child or baby to become a very irritable, fussy, angry, aggressive, and there is a reason for them then fitting on that scale. What we know is that there's a variety of causes that can cause autism spectrum disorders, and that they all share some very similar traits, and that everybody is working very hard to investigate what the cause is. There is roadblocks in any research that has to do with questioning the safety and efficacy of vaccines because it is a big machine. But what we know is that young neurological systems can react differently per person, and some people, just like some people respond to antibiotics in a positive way, and other people will have a terrible adverse reaction and for the same product because they're just a different system. So when we're looking at autism spectrum disorders, what we're trying to do is rebalance that system, try to identify possible causes, and then make some changes in the plan of care. We know as making changes in the plan of care for these individuals can calm some of these secondary symptoms down. And secondary symptoms can be the temper tantrums that can result from a child or a young adult being very overwhelmed with just a change in the routine. Some people don't talk, and changing certain dietary things, increasing the omega-3 can increase their ability to speak. It's different for each person. Oftentimes they don't absorb nutrients the way they need to because their body doesn't work right. They've got digestive disturbances, the inability for their gut to process certain foods. They can be very reactive or hypersensitive to foods. They may not have a true allergy, but the severity can be just the same. And by identifying what foods are irritants or causing reactions and what ones aren't, can make a difference. Making sure that they're getting a whole foods diet can make a huge difference in a child's personality. Oftentimes the depression and the irritability can be softened or calmed down. Changing their nutrients to help them sleep. Adding melatonin. Oftentimes the autistic person or the Asperger's person, or even the person with sensory processing, does not have regulated sleep cycles.